The liver doesn't complain loudly. That's actually one of the biggest reasons liver disease often gets caught late. But before things get serious, your body does leave clues, and a lot of them show up on the outside, on your skin, your eyes, even your nails. We're going to walk through the most important ones, explain why they happen, and help you understand when something is worth getting checked out. This isn't about scaring you. It's about giving you information that could genuinely matter. Let's start with the most well-known one, yellowing of the skin and eyes. Doctors call it jaundice, but the simple explanation is this. When your liver isn't processing waste properly, a yellow pigment called bilirubin builds up in your blood. Bilirubin is a byproduct that forms when old red blood cells break down. Normally, the liver filters it out. But when the liver is struggling, that pigment has nowhere to go, so it starts settling into your tissues, your skin, and especially the whites of your eyes. The eyes usually show it first. If you notice a yellowish tint there, not a trick of the light, not tiredness, that's something worth taking seriously. A lot of people assume it's just fatigue or bad lighting. It's usually not. Now here's something most people haven't heard of: spider angiomas. These are tiny clusters of blood vessels that spread out from a central red dot, and they look almost exactly like a little spider sitting under your skin. One or two of these on your body can be completely normal, but when you start seeing them in clusters, especially on your chest, face, or upper arms, that pattern can be a sign that your liver isn't regulating estrogen the way it should. The liver actually plays a role in breaking down hormones. When it's damaged, estrogen levels rise, and that causes small blood vessels near the surface of the skin to dilate and become visible. It's one of those signs that looks harmless but carries real meaning underneath. Have you ever had itchy skin that just wouldn't go away? No rash, no obvious reason, just persistent itching that drives you crazy. That can be a liver symptom too. When bile, the fluid your liver produces to help digest fats, starts backing up into your bloodstream instead of flowing into your intestines properly, it deposits bile salts under your skin. And bile salts are intensely irritating to nerve endings. The itching that comes from this is usually worse at night. It doesn't respond well to normal moisturizers or antihistamines, and it tends to affect the hands and feet first before spreading. A lot of people spend months treating it as a skin condition when the actual issue is deeper. Let's talk about palmar erythema, which is just a medical way of saying unusual redness on the palms of your hands. Specifically, the outer edges of the palm and the base of the fingers turn a warm, blotchy red. It doesn't hurt, it doesn't itch, it's just there. This happens for a similar reason as spider angiomas: elevated estrogen from a liver that isn't breaking hormones down efficiently. It's actually a fairly reliable early sign, and it's one that doctors look for during physical exams. If your palms have been unusually flushed or red, especially consistently, that's worth mentioning to a doctor. Here's one that surprises people: bruising easily and wounds that seem to take longer to heal than they should. You bump into something lightly and end up with a bruise that looks like you walked into a wall. A small cut takes days to fully stop bleeding. The liver produces most of the proteins that help your blood clot. When it's damaged, clotting factors drop, and your body loses some of its ability to manage even minor injuries. So if you've been noticing that you bruise at the slightest touch, or that small cuts linger, it's not always just thin skin or low iron. The liver could be part of the equation. There's also something called leukonychia, white spots or white bands across the nails. Now, the occasional white spot on a nail is usually just minor trauma. But when nails are consistently pale, have horizontal white lines running across them, known as Merkes lines, or when the nail appears half white and half pink. Those can all reflect low albumin levels in the blood. Albumin is a protein made by the liver, and when liver function drops, albumin drops with it. The nails are surprisingly sensitive to this change. One more skin sign worth knowing about is xanthomas. These are small, soft, yellowish deposits of fat that form under the skin. They usually appear around the eyes, on the elbows, or on the knees. They're not painful, and they're not a rash. They look almost like tiny, waxy bumps. Xanthomas form when fat metabolism is disrupted. The liver is central to processing fats and cholesterol, so when it's not working well, lipids can start accumulating in unexpected places. Seeing xanthomas isn't an automatic sign of severe liver disease, but it's a reason to get your liver and cholesterol levels checked. Now, one thing worth clarifying. None of these signs alone automatically means liver damage. Jaundice can have other causes. Itching can have other causes. What makes these worth paying attention to is when they appear together, or when they're persistent, or when they're new and you can't explain them. The liver is remarkably resilient. In early stages of damage, it can still function well enough that you feel fine. That's actually the dangerous part. You feel okay while the damage quietly continues, which is exactly why these skin signs matter so much. They often show up before you feel sick. If you drink alcohol regularly, have had hepatitis, take multiple medications long-term, or have a family history of liver disease, you have more reason than most to stay aware of these signs. But even without those risk factors, the skin is always worth watching. So let's bring this together. Your skin isn't just a surface. It reflects what's happening inside, and the liver is one of the organs most likely to communicate through it. Yellowing eyes, persistent unexplained itching, red palms, spider-like blood vessel clusters, unusual bruising, nail changes, and fatty deposits under the skin. These are the signals worth knowing. You don't need to become anxious every time you scratch your arm, but you do deserve to have this information, because catching liver problems early makes a real difference in what treatment can do. If anything in this video made you think, I should probably get that checked, do it. A simple blood test can tell you a lot about how your liver is doing. Don't wait for pain. The liver rarely gives you pain until things are already advanced. If you found this helpful, subscribe. We put out health education videos every week in exactly this style. No fear tactics, no exaggeration, just useful information explained clearly. And if you have a topic you'd like us to cover, drop it in the comments. We do read them. Take care of yourself. The small things you notice today could genuinely matter later.